my family now, if we can help it, we try to make sure that my 83-year-old grandmother never goes to an appointment alone because we want to be there. We want to be there to help, raise issue with, some of the things that she's experiencing, to ask some of those questions, to write the information down, because it is important. It is really, really important that we're there for one another. I heard you, Dr. Allen, talk about telling your friends. And that's right. It's one of the most beautiful forms of community is, hey, like, let's get these screenings together. And yes, it is scary. And yes, it is uncomfortable, right? We talk about the process. We, talk about all of it because we know that it's important that people know what that health screening, right, is going to look like.
Greetings and salutations, everybody. Here is a new episode of We're Not Okay, a community of healing. I am one of your hosts, Justin Stewart, and I, of course, am joined by my co-host.
Dr. Antija Allen.
And as we always do, we have a conversation, thrilling, exciting, lots of twists and turns. You know how we are. It's almost like always the cliffhanger, but we have a happy ending at the end. We are very, very pleased and honored to welcome our next guest by the name of Bryce Kahari. Bryce is the Cancer Program Manager at the Center for Black Health and Equity, where he oversees the planning, implementation, and evaluation of cancer initiatives within the center's tobacco and center programs. With over 12 years of experience in public health, Bryce has worked with local, state, and national partners across substance abuse, tobacco, and cancer control, LGBTQI plus, health, race equity, and youth and young adult programs. So he's been done a lot of things, been with a lot of different populations. His work is grounded in addressing the root causes of inequities by challenging the systems that continue to harm Black and marginalized communities. Now, before Bryce joined the center, he served as training and technical assistance manager at the National LGBTQI plus Cancer Network. He is also, in his spare time, or maybe his regular time, a poet and storyteller, and serves as editor-in-chief of an online poetry community. Without further ado, Bryce, we are very excited and very happy to welcome you to our community of healing. How are
Thank
you
you
today?
so much. Thank you. I'm doing so well. I am so grateful to be here with you all. So excited and honored to be asked. I'm really looking forward to this conversation.
So are we.
Well, before we can get into, a lot of the topics that we really want to discuss a bit more, we need to start with getting some background on the role that you play uh, at the center. So if you can talk a little bit about your maybe journey into public health and just your motivation to even do this work that you're doing right now.
Yeah, absolutely. So, I actually started as a freshman in high school. I started as a youth advocate. I joined. I'm in Mississippi, and so I joined my state's anti-tobacco youth board. And the reason why I did it was because my grandfather was a pack-a-day smoker, and I wanted to get him resources. I wanted to really see what I could do to help him quit. And he got addicted to tobacco after dropping out of school in the fourth grade. And so I also didn't want other youth to have to go through what he went through. And so it was an amazing and incredible opportunity where throughout my time, all my 4 years of high school, I was able to travel the state and put on youth conferences and do some coalition building around really advocating for, tobacco-free policies. Really, really wanting to make sure to do everything I can to help to educate the community. I always say that I'm an artist first and foremost, and so that comes through in every way within my work. With being a storyteller, with being a poet, and working to empower artists. It's really connected, right? I really have been able to connect my two loves of public health and art. Together in so many different ways. Um, you know, I after those 4 years of high school, my plan was to move on. This was great. This was incredible, right? Working in tobacco control, substance use prevention, right? But it's time to move on. It's time for a new challenge. But unfortunately, or fortunately, tobacco has not let me go. And so, I mean, it's been, I think now 12 to 13 years later, and I'm still in the work, still working to really help to advocate for communities that have oftentimes not been heard, that have been ignored, that have been discounted, really working to ensure that we're advocating for those communities. That I am also really working to pass the mic, like raise my hand in spaces like, hey, it's not me you need to be listening to, it's these folks. And it's why I love the work that I get to do at the center because we are so connected to grassroots organizations, people who are on the ground day in and day out, who are in this work because they care about their communities, they care about their community's health and well-being and longevity. And that's what brings me to the work, right? Is the word community. It's my favorite word. And it's my favorite word because there's such a bounty and there's such a space of healing and power that can be rooted in community. And so that's my call. That's what I know that I'm here to do. And I'm really grateful that I have the opportunity to get to continue to do that and to help advocate for communities and to help, be a storyteller as I continue my work in public health, especially at the center.
I think so many of us get into the work that we do, especially when it's like that heart work or that soulful work, because of our personal experiences and because of our own background. So listening to your story, to talk about your own grandfather, correct? And you know that journey into where you are now, helping several more people than maybe you even imagined at that early age, right? So, can you just talk a little bit more about um, the role itself as the manager for the cancer program?
Absolutely. So within the center, I mean, we're focused on a wide array of programs. The work that I get to do, is really working to address the cancer disparities that are so prevalent within our communities. We're really proud at the center to be one of, CDC's nine national networks to address tobacco and cancer disparities. And so with that, a lot of my work is around working, we fund local community coalitions, right, that are really focused on addressing tobacco disparities within their communities, and also addressing cancer disparities, screening disparities. We work with so many phenomenal communities. These look like universities. These look like, tobacco-free coalitions. These look like grassroots organizations that are working to expand screening access and expand, education to their communities so that they can, be as healthy and as safe as possible. And so a lot of the work that I get to do is around providing, training and technical assistance. At the center, we always say that our bread and butter, what we do really well is helping to build capacity. And so a lot of my work is around really working with organizations to help build their capacity so that they can fight for themselves, they can fight for their communities and, really create the change that they know. We have so many folks that are often so ignored who do this grassroots work, and they are the experts of their community. They know what's wrong, they know what's going on, right? They're deeply connected, right? To the problems that their communities face. And so we're helping to hopefully be a national organization that can help amplify their voice, right? But to also help them get the skills and resources they need, the funding they need to be successful.
Today's episode is sponsored by BetterHelp. Here at We're Not Okay, a community of healing, we've built a space where individuals can come together to process grief, manage stress, and share truths that are often carried in silence. Now, healing isn't only about conversation, it's also about getting the right support when you need it most.
That's where BetterHelp comes in. They connect you with licensed therapists online, anytime, anywhere. So you can get guided help from an expert in a supportive space you can trust. Therapy isn't just for the hard moments, it's also a tool for personal growth and development. And one of the best features of BetterHelp is that if you don't feel like that first therapist is the right fit, you can easily switch to a therapist that you truly connect with.
With over 7,000 reviews and a 4.5-star rating on Trustpilot, BetterHelp is a platform that you can rely on. It's something that you can trust. So visit betterhelp.com/ the Not Okay Pod. Again, but it's going to be down here too. betterhelp.com/ the Not Okay Pod. And with that, you'll get 10% off your first month of therapy. Because just like this community, you don't have to work through life's challenges alone. As we're talking more about your role, one of the things that the center has is their state of Black health. And most recently, I don't think you all have released the 2025 findings, have you all?
We have actually, yes. They are on
Make
our website.
Makes it even better. So as you've broken down everything that you've spoken about to this point, Bryce, I was hoping that we could really go over the findings for 2025, and just as we're looking into the center's work, which you've already kind of alluded to this point, and of course, as Antija mentioned, like the personal ties to your family, based on what has been shared, what are some of the, I would say, some of the urgent health disparities if we're talking about what's affecting the Black community today? What do you think stuck out of that report?
Yeah, well, I mean, at the center, we really work on addressing, menthol and tobacco disparities, cancer disparities, cancer prevention, HIV, AIDS. We've had programs around COVID-19, along misinformation, along disinformation, also food and nutrition, women's health, equity-centered policies and mental health as well. So we really span the gamut. And so all of those programs and all of those causes are so incredibly important. We know that many of those are areas in which Black communities have often not had the resources that they needed because of systemic reasons, right? We know that so often our communities are not given the resources, the money, right, the opportunities that we need to be able to succeed, right, or to be able to have the most be able to make the most informed decisions about ourselves, about our bodies, about our communities. And so all of those causes really, really resonate for us at the center. And what I love about State of Black Health is it's a really great opportunity for all of those issues and so much more, right? And to get incredibly passionate leaders. We had over 400 leaders to attend State of Black Health. And, State of Black Health is our conference that we hold every 2 years. And at State of Black Health, we are really looking at developing programs that really help attendees, right, within public health, really, connect to really strategize about and develop solutions, right? So often when you go to conferences, right, it is so, and I know this because I just came off of several conferences this fall season. You go to conferences, and so often, you are hearing speakers present, and they're presenting data, and they're presenting their findings, and they're presenting their work, which is all phenomenal. But a lot of times it's not solution oriented, right? There's not, those calls to action. And that's something that we really wanted to make sure at State of Black Health that we do every single time, especially this year, right? We know this year in 2025 has been a really unique year. We know that public health infrastructure across the country has been, dismantled, has been under attack. And so one of the first decisions that, our executive team made is we're still having State of Black Health. We're still bringing people together. We're still, creating the energy, the momentum, the fuel that people need, right, to be able to do this work. And that's exactly what State of Black Health was. In 2025, it was my first time, getting a chance to actually, do it as a staff member. Previously, I had attended, 2 years before when it was in the gorgeous and beautiful Puerto Rico. And Charlotte was the host for our 2025 conference. And our theme was around a call for health justice. It was really to help, acknowledge the shifting and the changing tones in federal support, and to really help re-energize folks. We need advocates, we need fighters, we need community leaders, right? Coming together to talk about how we move forward and how we make sure that we are advocating and protecting Black communities. It was a phenomenal conference where we were able to have, Representative Justin Pearson from Tennessee, who really gave us such a rousing call to action about just the importance of community and the need to lean on one another and to also use strategy so that we're able to affect change. And that includes by running for, public office. And, it also includes holding our representatives accountable. At the center, we regularly talk about the importance of holding our elected leaders accountable, and really helping to, just make sure that people in agencies, if they said they were going to do it, that they should do what they say, right? And if they're not, then as folks who are constituents, as folks who are people in this country, we should be holding them accountable. And so we saw over 130 speakers, over about 4 days of programming, and the topics spanned the gamut, right? We also really had some really great skill-based workshops in addition to all of the topic areas that I had, already mentioned that we do at the center, things around economic justice and, also around grant funding, skills that we know are going to be so important for our communities to be able to grow if they're going to help sustain the great work that they do. And you all mentioned the findings for 2025. So we have a phenomenal evaluation partner, called Rockman, and they put together this really comprehensive report. And one of the first things that we heard from participants is that this conference was not a moment. It was a movement, right? It wasn't just a conference where we all came together, right? It was a gathering and a real call to help reimagine health equity as liberation work. What we saw over and over again in the surveys is that people felt affirmed. they felt connected to one another. You know, 2025 has been exhausting, and you know, it really helped to put fuel in folks' tank. And what we really saw over and over again was that we were able to have really great attendance across the country. You know, we even had some international attendees, and people really loved the different offerings that we had, the clinics that we had, you know, to help in reference to wellness and chronic disease, institutional reform, like I said, skill-based things like advocacy strategies and you know, federal policy responses. You know, so really helping to, you know, help folks get the energy they need, help to get them the skills, right? But then also networking, right? Because so often, right, you know, the people we know people who need to know each other, you know. And what I think we do really well at the center is we're like, hey, y'all are doing phenomenal work. And we have another partner that's doing incredible work, right? You know, the two of you should connect and partner together and talk about ways in which you can support each other in this work. So many attendees really appreciated that the conference was really cultivated and really tailored to meet the moment. You know, attendees regularly said that it felt like that they were able to leave with their marching orders, right? They were able to leave with storytelling, right? And really impactful programming that is going to help sustain the momentum, but is also really going to help set the tone for an incredible 2026. You know, 2025, you know, while many folks have said it's been a setback, and in many ways it has, but it's also been a setup for momentum and progress and challenge. It's a call for us to really hold our communities even tighter, to raise our voices even louder, to do all that we can to protect Black folks, and to ensure they're here as long as possible.
Very powerful stuff. Just it's always great to have in these instances where, you know, we have a lot of disparities, we have a lot of challenges that are going on. And similar to yourself, it sounds like having that opportunity to collaborate with, as we always use the term, like-minded thinkers to kind of create some type of movement or some forward momentum, which is most important to drive solutions as opposed to continuously talking about the problems. We can talk about it till we're blue in the face, but I'm glad that the organization, the network, the findings reflect, and the conferences that you all have are reflective of the fact that we understand what the problem statement is, and this is how we're going to move towards our version of a better tomorrow. So thank you for sharing all that, Bryce. As we continue the conversation, I wanted to pivot a little bit back to what you've been talking about to as it pertains to tobacco and the ties to cancer. I know you were mentioning before about your grandfather and his usage, and I think community-wide, talking about Black community, kind of the association with usage of tobacco. Pulling from you all's website, it is you all state that big tobacco has appropriated our culture, and we think about the 50s and smoking cigarettes, sometimes a pack a day, sometimes people 2 packs a day. I have family that have smoked cigarettes as well. But then there was such heavy marketing, but it had such a heavy impact on us because I think for Black community, we have a higher cancer burden as in comparison to other communities, but also dealing with targeted marketing, the impacts of menthol, and then as you alluded to earlier, systemic factors. Now, while we have pivoted from the usage of the cigarette. Now we transitioned to e-cigarettes. We've transitioned to vaping. We've transitioned to hookah. So these are different things where it's like, oh, you know, it's safer. It's not like cigarettes, but in the same breath, I think there are things that we're not aware of the damage that it's continuing to do. So as it ties to those different factors, and again, honing specifically on tobacco and cancer, can you kind of explore that idea a little bit more? what was now a cigarette is now these other forms that are still impacting us.
Absolutely. I mean, and you are so right about, how, we continue to see the times change and the products have different names, but unfortunately it's the same strategies. We've seen, unfortunately, tobacco industries that have, unfortunately exploited the suffering of Black communities, of communities of color, of marginalized communities, again and again, to ensure that they continue to hook us with their products. They know that we have gone through discrimination. They've known that we have gone through so many systems of oppression, and they've exploited that and they've used that to market menthol products and flavored tobacco. And when you talk about menthol and flavored tobacco, the reason why menthol is so dangerous is because it makes these tobacco products easier to use and so much harder to quit. And for these tobacco industries, they really, really, really did everything they could, and still are doing to really, see Black culture as, tobacco is embedded within Black culture. And we reject that notion absolutely. You do not get to be part of our culture. You do not get to be part of our celebration, our community, our heritage, right? If you are marketing products that, when used as intended, can harm or even kill us, you don't get to be part of our celebration. You don't get to be part of our joy. You don't get to be part of our liberation, right? And it's important that we call these industries out, and that we really do all that we can to make communities aware, right? That, this is what these industries are doing. And this is also why, we want Black folks to live as long, as healthy, lives as can be, right? And that doesn't, and that happens when we turn away from these substances, right, that are so harmful. We are, and I do want to shout this out, because I think it's really important. We've had several surveys, and several studies, and reports that have come out in 2025, including American Cancer Society, including from the National Cancer Institute, that have found that cancer death rates are declining. Which, let's take a moment and celebrate that. Let's take a moment and applaud for that. I think so often we get, in this habit of talking about the bad, the bad, the bad. But we've had tremendous folks, right, who are working in cancer prevention, who are working in cancer care and survivorship, that have, really helped to ensure that we're seeing more folks that are getting screenings, that we're decreasing in death rates, and that's across men, women, children, across race and ethnicity, right? And a lot of and a big part of the reason, of this, especially when we talk about the declining rates of lung cancer, is because people are not using tobacco as much as they did, right? Which is incredible. And so we're seeing, all of these cancer death rates decline. It's still, though, a reminder, and all of these reports highlight it, that even though we are making tremendous progress, right, there are gaps. There are still, vulnerable populations that we need to talk about. It's really important for us, when we talk about cancer care at the center, that we really focus on raising awareness of, the cancer disparities, especially around breast cancer. We know that, unfortunately, Black women tend to have their cancers diagnosed at later stages. And we also know that we have a healthcare system that is continuously ignored, belittled, and have caused, right, so much suffering and death to Black women in healthcare. And so it's important that we talk about that and that we're aware of that. For us at the center, when it comes to Black men, one of the biggest, types of cancer is prostate cancer. It's almost 70% higher when you look at Black men and white men, right? And so, we're currently working on developing this incredible education campaign where we are, looking to talk to, Black men who are sharing their experiences of getting screened or, going through, treatment for prostate cancer and really learning and kind of gleaning how we can do better, in reference to our marketing, in reference to, the work that we're doing to tailoring our advertising on our health messages, because we want to reach as many folks as possible, right? We want to make sure that we are listening to our communities, right? They're the experts on themselves and their communities and what they know is going to work. And so that's what we do. We are always asking for feedback. I know that there was quite a lot in the in the question that you asked. So I please like follow up if I didn't answer, everything.
No, that's one of the instances where you answered plus more. And
Oh,
I was
awesome.
curious about the additional basically the bright spots, the positive. So you captured all that. So thank you very much, Bryce.
Absolutely.
So, you mentioned tobacco, obviously, is one of the areas that you all focus on. And there are, well, one program that I wanted you to give you the opportunity to highlight, the No Menthol Sunday. So if you could talk a little bit about that. And then also, most recently, I saw that you have the National Menthol Strategy um, on your website. So if you can talk a little bit about those two and kind of how they tie into the work that you're doing around cancer prevention.
Absolutely, absolutely. So, when we talk about No Menthol Sunday, we know that it is so important that we address menthol and flavored tobacco disparities. And so, No Menthol Sunday, it's our annual call to action. Especially for faith-based communities and community leaders across all faiths and spiritual practices to really help to educate their congregants and their communities about the dangers of smoking, about the dangers of vaping, and the unique role that we know that menthol and flavored tobacco continue to play, in reference to our community. I think, Justin, you said it earlier that we're still seeing, unfortunately, a lot of folks who are turning to e-cigarettes, turning to hookah. And, whenever we talk about e-cigarettes and vapes, just because it's a lot of misconceptions that people think it's just water vapor or it's just flavors, but it's not. It's so much more than that. And, e-cigarettes, the majority of them contain nicotine, and nicotine in any form is going to change how your brain and body react and function. And nicotine is also the addictive products in tobacco, and in many e-cigarette products, right, that have kept folks hooked, right? When we talk about nicotine, right, that's their tool to keep getting more money out of folks, right? Because they know that it's going to keep folks hooked and coming back for more. And so, when we talk about, things like hookah, we're seeing that, even in a lot of our Black cultural spaces, people are using hookah. And unfortunately, a lot of them don't know the dangers of hookah smoke, the dangers, of it. And so it's really important that we make people aware of that. And No Menthol Sunday is a really phenomenal way to do that. We know that we've lost so many people, and the majority of Black folks who use tobacco products are using menthol products. right, are using flavored tobacco products. And so No Menthol Sunday is really our opportunity to really help to educate, to spread awareness, but to also advocate for change. We really want that to be a year round. It's hosted in the third Sunday in May, but we have really been, and what's been really made clear, not just at our state of Black Health, but just across all of the different aspects of tobacco control, is that No Menthol Sunday is a movement. And it's been so incredible to just talk with some of our other partners, and they're going through so much right now. As I said, public health infrastructure and data is really under attack. And they continue to share that No Menthol Sunday has been such a bright spot for them. It's really helped to, encourage and empower communities. With No Menthol Sunday, we always put out an annual toolkit that we fill with different activities from a lot of our partner organizations. I mean, you're getting, communities that are hosting, so many different types of events, whether it's spoken word, poetry events and competitions, or it's actually having menthol funerals, or it's, doing something in reference to policy change. Even things as small as having an announcement, right, at a church service, at a worship service, right? Or looking at how you can have different types of events. Maybe it's a food event, a fish fry, whatever, but you can gather people around, right, and help to give them the information, right? We know that when people feel empowered, when people feel that they're informed, right, they're more likely to take action, right, for their health and their well-being. And so that's what we want to do. And so No Menthol Sunday is really a really great opportunity. It's a fun way to really be able to do that. And I'm so glad, Dr. Allen, that you mentioned about the no menthol strategy. We're so incredibly proud of it. We have some phenomenal folks at the center who have really come together with our national partners. Unfortunately, we have seen, the previous two administrations really not, hold up their end of the bargain, especially in reference to, the FDA being able to regulate, menthol and flavored tobacco products. And so, especially when we talk about, menthol, right, it's really important that we, gather together. We wanted to gather together with so many of the incredible organizations that we get to work with across the country. Organizations like the African American Tobacco Control Leadership Council, and so many others, right? To really have an opportunity where we can say, look, we know the danger of menthol, right? We know the harm that it's done, right? And it's really important that we are really able to talk about what are the priorities in reference to addressing menthol, right? What does it look like if you're advocating for a menthol and flavored tobacco policy, right? At, the local level, at the county level, at the state level, right? And so even though this document is certainly not, exhaustive of all of the policy recommendations, of all of the recommended actions that can be taken. It's a really phenomenal guide where so many incredibly respected organizations are coming together, and they're saying, hey, this, these are the ways in which we can start to make change, to really prioritize menthol, so that we can start to see a reduction of folks who are using menthol products. I know and can personally say that my grandfather, used menthol tobacco products. And, for him, I think too about how, we've made so many great progress, especially in reference to youth using tobacco. And just, my hope is that nobody else ends up like like my grandfather getting hooked at such a young age, right? And it takes us being innovative. It takes us, collaborating. It takes us being able to have the hard conversations, and to also be creative, and so it's, just finishing up with the incredible menthol strategy. It really highlights the historical relationship that menthol has played in the Black community, how the tobacco companies have marketed these deadly products, and it shares really great, information and timelines, especially in reference to the FDA, and them being able to regulate these products. It also talks a lot about the strategies, right, that can be used by communities and coalitions at any level, by people at any level, to help really focus on addressing menthol. And it also gives folks resources to continue to spread awareness, to continue to, have model policies so that they can be able to craft from, right? But also, information about how they can quit, because we know that quitting is possible. And it's really, really important that we let people and make people aware of that. Even quitting for just a day, right, can have a tremendous positive impact on your body. And so, there's so much more that the menthol strategy does. And so I would definitely encourage everyone to go to our website. It's completely free to download. You can share it as a resource with your communities, to really help to talk about, and give actionable ways to address menthol.
And one one part of what you shared earlier and you spoke about just now was the idea of working with the youth um, when it comes to this because of that focus, I think heavily on prevention, right? Because once someone becomes addicted, especially to tobacco, um, it almost feels like it has a hold on them that they just can't shake, loose, right? So a really good friend of mine, his dad passed away um many years ago, but it was over time of just tobacco use. I mean, he will tell stories of how he literally is on an oxygen tank and still trying to smoke a cigarette. You know what I mean? Like that is something that clearly has a true hold on folks. And so the work that you're doing and the work that you are helping other communities do around prevention, especially for the youth, is so, so, so important. I think when I did research. I want to say this was many years ago at Albert Einstein College of Medicine. We did a lot of work with the youth around HIV prevention and also preventing smoking at an early age. A lot of the research said that many people who are addicted started at like I think it was around 11 to 13 years
Yeah.
old.
Yeah, the average age of initiation is typically around 13. It's crazy. And we're seeing so many people, I mean, even younger than that, right? I mean, again, my grandfather in the fourth grade, and you're so right, Dr. Allen, that it is, it is so that's why it's so important for us to reach youth at younger ages, right? Because we know, from the data, right, that if folks are if folks are not using tobacco products, by the time that they reach the age of 18 or especially 21, they're least likely to be hooked on tobacco. And so you're absolutely right. It's really important that we really help to educate the youth, to make them aware, as Justin was talking about, those emerging products, and those new products, and let them know that, those products are very dangerous.
So one thing I want to make sure we touch on is I know that our time is running short, but I really want to make sure we focus on this a little bit. Are your recommendations around screening and prevention, just for cancer in general? I will say that on Thursday, because I'm sure everybody here wants to know, I am getting my colonoscopy,
Yeah.
which is Super
Yes,
uncomfortable to even think about. But guess
of
what? It is
course.
it's a need. It is something that even when I was talking to my doctor, he's like, if you have siblings, if you have friends, who, are, and he was very focused on like the Black community. Make sure that you
Hmm.
tell them it's time to come in, it's time to get screened, right? It's time to have these things done. Mammograms, when I go get my mammogram, I'll contact my friend. Hey, did you get your mammogram this week? So I think it's so important for us to talk about these topics, even in conversation with our friends and family members. Again, not fun stuff, but a
Right.
necessity. And the earlier you find out, if there is anything to find out, the better. And so, are there any
Absolutely.
recommendations that the center has that you can share around just screenings, especially for our community?
Absolutely. Well, number one, I mean, we have tremendous, recommendations and guidelines around, the ages and eligibility of, folks to get screened for different types of cancer, right? And so absolutely pay attention to that. Also know, and some, we're continuing to see, this change. I know it's definitely, the eligibility is definitely changed in reference to lung cancer because they saw that folks were, getting lung cancer at early ages, and we're seeing that unfortunately. It is important, number one, to really make sure that you are paying attention to, like, hey, if it's recommended at this age that you need to get this screening, that you speak with your healthcare provider. One of the best and most vital things that people can do is to really make sure that they have a health provider they can trust, a health provider that they feel comfortable with, right? Where they can ask those hard questions, where they can be able to be honest about their own health history, but also their family's health history, right? Because we know that oftentimes we see cancers that are, genetic. And so it's really important for people to do that. Something else that is really important to do, and this is true for people no matter, if you're someone who is, looking at, making sure that you stay on top of your preventative health screenings, or, you're actually someone who is currently now going through the process of receiving treatment for cancer, or even if you're a, cancer survivor, right? One of the biggest things that I always tell people is talk about is the importance of being able to advocate for yourself. It is so incredibly important, especially because we know that we have health systems, right, that have often not prioritized Black folks, that have often not, really respected us and really, done things with our health and safety and well-being in mind, right? And so, as much as you can to advocate for yourself, to come with friends and family, right? And so they can be there to advocate for you, right? Is so, so, so important. I mean, I now, my family now, if we can help it, we try to make sure that my 83-year-old grandmother never goes to an appointment alone, because we want to be there. We want to be there to help, raise issue with, some of the things that she's experiencing, to ask some of those questions, to write the information down, because it is important. It is really, really important that we're there for one another. I heard you, Dr. Allen, talk about telling your friends. And that's right. It's one of the most beautiful forms of community is, hey, like, let's get these screenings together. And yes, it is scary. And yes, it is uncomfortable, right? We talk about the process. We, talk about all of it because we know that it's important that people know what that health screening, right, is going to look like, and that they know the purpose of it, but to also know that when you have that information, then you're able to make good decisions, right? You're able to, hopefully, if there are any things that come up as abnormalities in your cancer screenings, you're able to hopefully get it detected early, right? Because the earlier that you can get it detected, right, the greater chance of survival, and that you are going to, and the greater chance that you're not going to be exposed to some of the really harsh cancer treatments, right? That are made available, especially for folks who are caught at later stages. So just, I always tell people the importance of, just, advocacy and community, and really making sure that you're paying attention, and that you're talking to your doctors, that you're staying on top of those screenings, that you're asking the questions, even if they're super uncomfortable, right? Ask the questions to your providers. And if you are with the provider where you feel like you can't do that, then it's time to get another provider.
I appreciate all of those items, just the aspect of advocacy, the aspect of awareness. Sometimes there are things that we don't want to face, and we kind of think if we're not aware of it, then that doesn't actually exist, and how it has all these future implications. I also think about, which we won't have this conversation for the sake of time, but the overall arching conversation about addiction and how we look at the concept of addiction. And while we're talking about something where some may be hearing this and saying it's just cigarettes, it's just vaping, but for those that have alcohol, for those that have menthol, for those that have other harder drugs, or nothing dealing with drugs at all, but just the aspect of addiction and how addiction can take us, and whenever we're not aware of it. So I'm glad again for us this conversation. We're glad again, Bryce, for you speaking with us today. And as we close out, I mean, we've had a lot of impactful conversation, a lot of things for folks to have action plans. If you haven't gotten your colonoscopy, if it's around that time, don't do it just because you're like in your 35. Check with your doctor, make sure it's the right time. But as we come to an unfortunate conclusion of this conversation, we are grateful for you, Bryce. We're grateful for the work that you do. We're grateful that I'm sure you're grateful that 8-year-old version of yourself is grateful for the person that you are now and your family. But as we look at everything that you give, well, I think what's most important for us as the community of healing is, what are the ways in which you receive joy? So for you, Bryce, as we close out, what are the moments for you that bring you the most joy?
Oh, that is such a good question. And can I say just how much I've loved this conversation? I'm such a fan of both of you and your tremendous podcast. I love how you both are placing healing at the center. It's what our communities need right now. It's what we deserve. And so thank you for all of your tremendous advocacy. One of my favorite quotes is by Bell Hooks, the legendary Bell Hooks. That one of the most vital ways that we sustain ourselves is by building communities of resistance, places where we know we are not alone. And so my joy, my bounty is found in community, right? It's found in rest, right? It is found in poetry, right? And art and music, right? I'm an artist through and through. I love all types of art. I love to dance. I dance a lot. And I try and surround myself with joy, because, there's a real, joy is a form of resistance, right? But it's also a key to our survival, right? We can't be going through this world with how unpredictable and chaotic and harsh that it can be without having joy, right? And we don't have to wait for some milestone or thing to happen for us to be able to lean into joy, right? It is available now, right? Joy is accessible now, right? And us finding that is so important. Us making sure that we're finding communities where, we feel heard, where we feel seen, right? That is what fills me up. That's what fills my cup up, and so, and also, just some really great trash TV is always really fun. Like, who doesn't love to just like watch a reality show and just kind of binge out on some of the crazy antics that people have? I mean, all of it is fun. I'm laughing. It's fun. And so all of those ways are ways that I really, really help to prioritize joy and healing. And the last thing that I will say too is, therapy has been such a really helpful tool, and it's been a really great opportunity for me to learn more about myself and learn more and improve myself. I think we should always be doing self-improvement. But I also want to say you don't need therapy in order to do that. I know that it's often inaccessible for folks. And so there are so many ways in which big and small that you can lean into joy, lean into healing, lean into self-improvement. And I encourage you that wherever you can find that, take that.
Feel like we usually do a closing, but that's all, folks. There's no better way to close it than that. So thank you again, Bryce, for all those that are listening.
Absolutely.
Bryce Kahari, it was a pleasure talking to you.
Absolutely. Thank you both so much.
Thank you.